Hello, and welcome to Healthcare Insights by Health Innovator. I'm your host, Hamid Mahmood, and today we're going to talk about the challenges faced by people living in remote areas of the U.S. in accessing care at the right time, and a few solutions to be able to solve for this remote care delivery challenge using modern technologies. It has been far too long that we have ignored this issue that affects 60 million Americans and not done much to solve for it. We need to be able to provide good care to these remote communities to make sure every American has access to good care, regardless of where they live. Medication adherence for a diabetic patient living in rural Montana is as important as someone living in an urban community outside of a major city in the U.S. Today, we'll explore challenges, innovations, and real solutions that can make a difference for these communities. But before we start, please hit like, subscribe, and if you like the video, please share with others as well. So to summarize the challenge, approximately 60 million Americans, about 1/5 of the U.S. population, live in rural areas where healthcare access is often limited. Many of these communities face challenges such as hospital closures, fewer healthcare providers, and long travel distances for medical care. For example, between 2013 and 2020, over 100 rural hospitals closed, forcing residents to travel 20 to 40 miles farther for essential services. Additionally, 17% of rural residents lacked broadband access as of 2019, making telehealth solutions difficult to implement. Some additional challenges for us to keep in mind are very limited healthcare facilities. Many rural areas don't have nearby hospitals or clinics, forcing patients to travel for hours for medical care. Thirdly, shortage of healthcare professionals. Fewer doctors, specialists, and nurses choose rural placements. Economic barriers, high costs, lack of insurance, and lower income populations struggle to afford treatment. Technological limitations. Many rural hospitals lack updated equipment and digital health tools. Transportation and accessibility issues. Elderly patients or those with chronic conditions face difficulty traveling long distances just to be able to see a doctor or get a prescription refilled. Maternal health crisis. More than half of rural counties lacked hospital-based obstetric services in 2018, contributing to higher rates of preterm births and mental health risk. Additionally, we also see very high mortality rates. Rural populations experience higher rates of mortality from heart disease, respiratory disease, cancer, stroke, and unintentional injury compared to urban populations. For our veterans, the healthcare access is very difficult to get. About 1/3 of veterans enrolled in the Veterans Health Administration, or VHA, live in rural areas, yet they use intensive mental health care services less frequently than urban veterans. Now, let's move into a discussion on two innovative solutions and approaches to solve for some of these challenges and provide access to care to our remote populations and communities. The first is telemedicine, and we don't need just telemedicine, we need a telehealth revolution. Telehealth has been around for a while, but the adoption has been very spotty due to a lack of streamlined experiences for the members, including difficulty in signing up, long waiting periods for physicians, not knowing which buttons to press where and when, and the related technical issues, and the related troubleshooting that comes with it, and not having access to technology. All of this needs to change, and it needs to change rapidly and significantly. And we need to rapidly enable and deploy telemedicine as a means for the people to get care in these rural states. To do this, we would need to do a few things. First thing to be done is to make cheaper electronic tablets to enable telemedicine and remote care delivery. These devices or tablets will allow for a limited number of apps to be pre-installed on them to only enable Medicare care delivery. These devices should be covered by commercial insurers and Medicare, Medicaid, or be cheap enough for the public to be able to purchase them. Secondly, we have to increase our cell phone and internet coverage in these remote states. This is where the government and the private sector have to work hand in hand to enable this. In 2025, in the US, there should not be many areas or states with low coverage just because of low population density. Everyone's ability to access care, regardless of where they live, is equal. The US government and policymakers, as well as private organizations, need to invest in rapidly installing cellular towers to increase cellular coverage and expand internet access. The cellular companies should be rewarded by giving tax rebates, cuts, and other incentives to install and maintain these towers on a regular basis. Thirdly, people living in any state should be able to get telemedicine-based care from any doctor residing in any other state in the U.S. Allow residents of the U.S. to be able to get care from a licensed doctor in the U.S. from any state to ensure point-in-time care rather than waiting for extended periods of time to be able to talk to a doctor in their same state. A US-based physician should be able to do a televisit and call in a prescription for a patient in the US regardless of where they live. The second solution that would enable us to provide healthcare to remote patients is the use of drones and what I call flying healthcare units. Could be used for a variety of different things, such as medication and durable medical equipment delivery to remote homes. This would ensure that no patient is without critical medication, such as insulin, regardless of their ability to drive to the nearest store or pharmacy to get a refill. This delivery method would ensure consistent and accurate medication delivery to the door of the patient, thus reducing the patient's burden of traveling 20 to 40 miles just to get a prescription refill. Additionally, these flying healthcare units, or FHUs, will be used for transportation of patients to and from their house to the nearest hospital in case of an emergency, thus reducing the driving burden and reducing delays in care delivery. In dire situations, meaning road accidents or other severe accidents, these can be used to transport hurt individuals quickly to a nearby hospital from the scene of the accident. Some of these could be manned and some could be unmanned. I'm sure right about now you're thinking that I've gone off the deep end here, but I'm telling you that I haven't. If no one is working on this type of a care delivery solution utilizing drones and FHUs right now, somebody will after they listen to this video. It will work. Also, this is not new. Last year, Dubai tested its first drone-based delivery of medication to patients. A lot of you by now might be thinking, why is all this necessary? Why should the private and government sector invest in this kind of a solution? The answers are very simple. Number one, improved outcomes for patients, thus reducing cost of overall care by allowing them access to doctors and associated care in the palm of their hands. Providing care when needed to patients and improving important metrics such as medication adherence rates, leading to overall reduced cost of care and improved outcomes. Management of one morbid condition will reduce the addition of other related comorbidities, thus improving outcomes and reducing the overall cost of care. And this last part is important for my hospital executives, is the ability for hospitals in urban settings to extend outreach into remote areas and expanding the primary care footprint and patient base and increasing revenue, not just for primary care, but also for managing any related chronic and specialty care and special conditions. In the end, I would like to reiterate that with technology, policy changes, and community collaboration, we can bridge the healthcare gap in America's rural heartland. If you would like to discuss more or learn more about how these and other solutions can be developed and deployed, please feel free to reach out using the contact information provided below. I would love to hear your thoughts regardless of whether you disagree or agree with what I've shared. Please share in the comments section and I will surely try to address your comments in a timely manner in any of my upcoming videos or within the comment section itself. Thank you for watching the video and I hope you found it to be useful. Please hit like, subscribe, and share. Thank you and take care.